Thank you, Mr. Chairman, for holding this very important and significant hearing today. When I get my notes squared away, this hearing is pure political theater. It's a farce, plain and simple. It's a comedy, but the audience has seen it so many times now that it's no longer funny. In fact, this hearing is an egregious waste of this committee's time, especially when one considers all of the legislation that remains unaddressed by the House, like immigration reform. The Senate has passed comprehensive immigration reform, but the Speaker of the House continues to refuse to bring the issue to the House floor. Yesterday, as House members walked down the Capitol steps on their way home from an exhausting one-hour workday, I watched as most members had their heads down. They wanted to avoid eye contact with the 50 or so young people standing at the foot of the steps in the cold wind. They had their hands clasped together, the young people, in prayer. Their prayer was on behalf of those families of immigrants that are being destroyed as a result of this nation's failure to pass comprehensive immigration reform. Their prayer was a simple one, that Speaker Boehner allow the House to vote on comprehensive immigration reform before the end of this session of Congress. The spectacle of those kids shivering in prayer in the cold last night could not be avoided by the members of Congress. So most kept their heads down, probably in shame, as they hastily escaped to the safety of their cars. I suggest that this committee hold a hearing on the question of why, despite immigration reform being supported by a majority of Americans, having been passed by the Senate, and the President having said that he will sign it if it ever gets to his desk, why is it that we can't bring that measure to the House floor for a vote? Mr. Chairman, this do-nothing House has only 7 legislative days left before it adjourns for its well-earned year-end holiday. The same Republican Party that has voted 46 times to repeal the Affordable Care Act is today, ironically, complaining that the President is not implementing the law quickly enough. But at its essence, this hearing, sadly, is simply a continuation of the majority's overwhelmingly obsessive and insatiable desire to kill the Affordable Care Act, which will enable 30 million Americans to have health care, 32 million Americans. 46 times they've tried and failed to kill it. The result of this hearing will not change the fact that Obamacare is the law of the land, and since today we are hearing testimony on the use of executive authority, let's not forget that the key authority for Congress to check the power of the executive is its Article I authority over appropriations. And by the way, this Congress has not yet passed a budget. Congress continues to shirk its constitutional duties under Article I. Funding the government through short-term resolutions is not leadership, and the American people deserve better. So after holding yet another hearing to obstruct this administration, perhaps this committee can also take up the question of Congress's duties under Article I in a hearing entitled "The Congress's Constitutional Duty to Appropriate Funds." Now, as far as the Affordable Care Act is concerned, the individual mandate is constitutional. It will reduce costs, prohibit discrimination against patients with pre-existing conditions, and extend coverage to the uninsured. It will extend coverage to 32 million Americans. The individual mandate is the key to this legislation being successful. It would ensure that millions of Americans will not have to worry about being denied health care because of a current medical condition or fear that their coverage will be capped if they get sick. To the members who have served longer than I on this committee, I invite you to look back to 2003 when a Republican-led Congress enacted the law creating the Medicare prescription drug program. Most Democrats voted against the bill in 2003. The program was also very unpopular with most Americans, but Democratic members worked hard when the program was implemented in 2006 and 2007 to to make sure that their constituents receive the full benefits of the program. It's unfortunate that the Republicans today are not doing the same thing. Mr. Lazarus, this is not the first administration to temporarily postpone the application of new legislation. How have prior Republican and Democratic administrations treated the implementation of statutes when statutory deadlines become unworkable?
Without objection, the gentleman will have 1 additional minute to allow Mr. Lazarus the opportunity to respond.
I'll try not to take the whole minute. The answer is that prior administrations have done just what this administration is doing because they have to. I quoted President Bush's Secretary of Health and Human Services, Michael Leavitt, in saying that the president's current decision to delay the employer mandate was wise, and he said that and then cited his own experience in phasing in Medicare Part D, the prescription drug benefit program. The Environmental Protection Agency, under all administrations, faces statutory deadlines that cannot be met. We all know that. The Bush administration was often chastised by environmental groups for missing statutory deadlines, and the environmental community charged in court, in fact, that the Bush administration was using delays as a cover for simply suspending the law as a de facto matter. I don't know what the basis for that was or was not. And of course, again, if a president refuses to enforce a law for policy reasons, that is a violation of his take care duties, but that's not what's going on here.
Thank you. I yield back.